The search for a lasting solution to the shortage and uneven distribution of medical doctors in Ghana received the needed boost when the Central University College took very bold steps as a private university to introduce the physician assistantship program into the country. The pioneer group of the 4-year Bachelor of Science in Physician Assistantship was admitted into the state-of-the-art School of Applied Sciences at the university's permanent campus at Mucho, near Dawinya, in 2008. The school also admitted students for the Bachelor of Nursing, Bachelor of Pharmacy, and a unique 5-year Bachelor of Architecture. The physician assistant is a trained medical person who is able to perform almost all the duties of a medical doctor.
This program is the first of its kind in Ghana, but then I know it is not a replacement of the medical officers training that is being done in the medical schools, but it is complementing the work of the medical officers, especially in the rural areas where the doctor-patient ratio is alarming.
The United States, which gave birth to the concept in 1965, in view of the shortage and uneven distribution of medical doctors at the time, has since relied on it for an effective health delivery. Though newly introduced into the country, this pioneer group of physician assistant undergraduates are very much aware of what it takes to produce high-class physician assistants.
The physician assistant program is new in Ghana, but the little research I have done reveals that the facilities at the School of Applied Sciences here at Mucho are the best you can get anywhere for the PA program. We are being taught by very experienced lecturers, well versed in medicine, from places like Korle Bu Teaching Hospital, Legon, UCC, etc.
We are reading courses such as internal medicine. We are doing physiology and pathophysiology. We are doing biochemistry. We are doing medical psychology and other related courses. I must say that because of the nature of the program, many West African countries have their citizens also joining, and we are all being trained to go into our respective countries to offer Medicare to our citizenry.
Barely 2 years of classroom teaching, laboratory work and clinical attachment at the various hospitals in the country, the students are giving very encouraging testimonies.
After the end of Level 100 program, we were sent out to the hospitals. I found myself at Nabita Teaching Hospital, where I was placed on rotation in 3 wards: emergency ward, surgical ward, and medical wards. Were involved in clerkship, helping the doctors, or they were actually teaching us to diagnose ailments based on signs and symptoms they gave. And we observed a few surgical procedures, craniotomies, laparotomies, and all the other tomies.
After my first year as a physician assistant student in Central University, I had the opportunity to have my practicals in one of the biggest hospitals in Ghana, that's Korle Bu, where I was sent to the medical and the surgical ward. I spent my first 2 weeks in the surgical ward where I had to prepare patients for surgery.
I went to Konfanochi Teaching Hospital in Kumasi. I was sent to the medical ward. I had the chance to be supervised by a doctor in the process of passing a catheter, setting IV lines, and then going to the lab for results.
The students are already getting excited about going out very soon to serve as physician assistants, and expectations are growing high.
I came here as a novice, and the way things are going, I can say that come July 2012, we would have been the kind of quality personnel that Central University intended training. So far, so good.
Training of more nurses of high quality is also crucial to the adequate and quality provision of healthcare to the society. Many nurses leave for the advanced countries to upgrade their skills. Most of them would remain in the country for further studies when the right facilities are available and accessible to them. The nursing department of the CUC's School of Applied Sciences, equipped with this ultra-modern nursing skills laboratory, offers the students a hands-on experience to easily fit into any health facility anywhere with no handicap. The nurse being trained at the School of Applied Sciences of the Central University College does not go to the hospital to learn on the job. The graduate nurse from CUC just goes to perform duties with very little or no supervision at all. Barely 2 years into its establishment, close to 200 nursing students are happily studying here for this highly practically oriented Bachelor of Nursing degree. The ultimate aim is to produce the ideal nurse the public has been crying for all these years. That is the nurse with the healing hand and caring heart. The Bachelor of Pharmacy program of the School of Applied Sciences is equally innovative and unique. It has been designed to produce pharmacists who are not only drug-oriented but patient-oriented as well. It is more clinical-based than one will find in other universities.
As we all know, pharmacy practice is moving from a product-centered approach to a patient-centered approach. That is why here at Central University, at level 200, you do a course, pharmacy practice, where you are introduced into pharmaceutical care. This course throws more emphasis on the pharmaceutical aspects in relation to patients, where we pay particular attention to patients.
Since the study of pharmacy is more confined to the laboratory, the state-of-the-art laboratory of the science faculty is a huge asset to the pharmacy department, and the students are getting the best out of it. The pharmacy department has links with most of the pharmaceutical industries in the country. The students are already producing some of the basic drugs and solutions. The Department of Architecture is also designed to produce architects who will have the maximum hands-on experience to effectively confront the challenges in the build industry. The Architecture Design Studio is duly equipped to cushion the students to become architects with a difference, not only in Ghana but in Africa and beyond. The course structure will enable them to critically examine architecture from various countries over the world. They will take into consideration the environmental factors in their design.
Within my 1 year stay in this school, I've come to realize that there are so many things that are important to the sustainability of the built environment. Here at Central University College, we've developed a curriculum of a 5-year course in structures, principles of structures and construction technology, which are both important to the success of the built environment. I think the introduction of these courses would help us become quality architects who would be able to design buildings which will stand the test of time.
Central University College, the place to be.